Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we will be discussing emergency preparedness planning for nursing homes. Everyone has entered this meeting on mute, but we will have a discussion at the end of the webinar. If you have any questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We encourage you to join us every Wednesday at 2 p.m. for more of our webinars in this series. For next week's webinar, we'll be giving a preview of a course we have coming up on staffing solutions for nursing homes. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. So Penny, welcome, and thank you for joining us again today.
Thank you, Kathy. And we're here today to talk about emergency preparedness. Specifically, I know over the last couple months, you've probably been hearing from myself and my coworkers many times, and just about every email we send, we were asking you those CMS questions about safe visitor, cohorting plans, and emergency preparedness plans. The responses that we got back from many of you were that the majority of you did have an emergency preparedness plan in place, but there were some people who did not. And so one of the things that we decided to do based on that, and also because of the changes that have occurred to the guidance for many guidance that we've had over the last couple of years, but for the guidance for the emergency preparedness plans with the Appendix Z, we decided to develop an emergency preparedness plan outline and checklist that I'm going to share with you today. So it's a resource that we developed based on the information that was updated in Appendix Z. And we'll be throwing that up here in a few minutes to show that to you. And then we'll be sharing, that will be one of the resources that will be available to our participating nursing homes. But just to go back over and give that quick background, I'm sure most of you know, but some of you may not. So I always like to, try to start at the beginning and not the middle or the end. So really in September 2016, CMS, Centers for Medicare Medicaid Services, published the emergency preparedness requirements for Medicare and Medicaid participating providers and suppliers. And the guidance was for many sectors of the healthcare systems, including long-term care facilities. And really, the rule required that nursing homes demonstrate that you're doing risk assessments, writing appropriate emergency plans, establishing your policies and procedures, and then training and testing the plans with staff and partners in the community. Sort of like those fire drills where you used to choose a unit that you would evacuate. You would have the local fire company come in and assist with the evacuation. So those are things that we've had in place for a few years. That was implemented on November 15th, 2017. And then some changes occurred, one of them being some hurricanes that happened. And one specific incident that Deb Wright had shared and reminded me of was the Hurricane Irma in Florida, where a facility lost power and many residents died. And there was a hospital just a few feet away that had emergency power up and running, but none of the facility's residents were transported to that facility that could have met their medical needs. And so based on that incident and incidents similar to that, on September 30th, 2019, the Burden Reduction Funnel Rule released some guidelines, and they made revisions again to the Emergency Preparedness Plan requirements. Many of the changes didn't affect the nursing home industry, but one of those that did was expanding guidance into emerging infectious diseases. And this definition was part of that all hazards approach that has part of, the final rule. Even nursing homes had to have, it was November 2019 when everything needed to be implemented for that final rule. Now, at that point in time, when they were talking about emerging infectious diseases, it was really, they were looking at, and this is how the world changes so quickly, they were looking at the Ebola virus and Zika, which were the two big emerging infectious diseases of the time. And now, of course, we know what happened since February, March of 2020, we have COVID-19. And so then as part of that, CMS again reviewed what they had in place for emergency preparedness. And in March of 2021, they released again a revised guidance to surveyors and to all healthcare facilities under CMS QSO memo 2115. And that updated guidance was to be implemented April 16, 2021. And that included those revisions to Appendix Z and the state operators manual. And that really expanded the guidelines to include best practices and planning considerations for preventing and managing emerging infectious diseases, especially considering the onset of COVID. And we do want to say that many of the bunch of the guidance surrounding those infectious diseases are recommendations and best practices, not necessarily requirements. But I always say when you're looking at guidance to surveyors, it's a really good idea to see what the guidance is and probably follow that as much as you possibly can. So really when we were looking at what we were developing has a guideline. And if you want to go ahead, Kathy, and put up the, let's start with the outline, put up the emergency checklist outline for me so everybody can see it and I can sort of share it.
Okay.
So you'll see here on the screen, the emergency preparedness plan, and with that we've developed that we'll be able to share with all of you. We have an outline and it kind of goes over what I just said, the final rule, everything to be effective November 2019, then the updates to Appendix C in March of 2021. And really the requirement is just really, the whole focus of this is increasing safety to your residents during an emergency. And now that we all know that, I think we were always aware, especially in nursing homes, I think fire was probably the number one. And then there were with flooding. I know in other states, they had to think about earthquakes, hurricanes, tornadoes that weren't so prevalent here in Pennsylvania. I think probably bad winter storms where we might lose electricity, flooding, and fire, like I said, were things that we probably all thought about within Pennsylvania and West Virginia nursing homes. But now, of course, those emerging infectious diseases such as COVID are things that we really need to think about. So really, we just went down through the guidelines of Appendix C and what you really wanted to have in place. You want to scroll back up a little bit, Kathy. And there are a couple of different elements, for what CMS wanted everybody to look at. There were kind of 4 core elements of your emergency preparedness plan. And they were first that risk assessment and planning. And then there's, developing your policies and procedures. There's a communication plan, which includes specific plans, how you're going to handle specific hazards that might occur. And then lastly, training and testing. So what we did with our outline, as you can see, is we kind of divided it into sort of those areas, called it something a little bit different, but really the first step is identifying your hazards. And the purpose of this is as I said, we know from asking the question of many of you that you probably have much of this in place, but we want to make sure that you really have everything in place that you need to look at, that even if you have an emergency plan, this is for you to take and look at it, make sure that you've included, that your emergency plans include many of these areas. No, we don't have at this point specific plans in place because we believe that most of you do have those to address specific areas, such as fire, tornadoes, how you will handle that. So this is really just an overview and an outline of what you need to really should think about having in place. Now, one thing that's different for long-term care facilities from other healthcare facilities is that we are still must make sure that we review and update our emergency plans annually. For some healthcare settings, they can do it every 2 years, but for long-term care facilities, you must develop and maintain that plan annually. So that's something that needs, I think, to be reiterated to make sure that that is done annually. And then that risk assessment, the documented risk assessment. There are a lot of different risk assessments out there. The risk assessment that you've decided to use to make sure that it's really facility-based and community-based, using the all hazards approach, but specific for your facility, for your community, whether you're a standalone facility or you're a continuing care community, will make a big difference on what your risk assessment is going to look like. And again, something that came out with the guidelines is making sure that you're including those missing residents. That has to be a piece of your risk assessment. And then those strategies for how you're going to address the emergency events should be, and there are a lot of good risk assessments out there, which I know everybody has already started to do the risk assessment. So you should have one, you should have it in place, you should be looking at it, addressing your population, and the type of services that you in particular provide. So those are the things that you really want when you're identifying hazards that could affect you, your nursing home, your staff, your residents. It's really to be facility and community-based focused. And then there's the communication plan piece of it. And this is where, I think we really learned a lot of lessons from COVID. But in developing that communication plan, I think a lot of people, and I think this is across the board, some people were more prepared, a lot were not. And it's not just nursing homes. I know we seem to get the brunt of everything that happened, and nursing homes, seem to be told over and over again that you didn't necessarily do the best job, which I don't believe is true. I don't think any healthcare setting was really prepared the way that they needed to be for a real event like COVID, and the way that it happened, and the guidance that was changing, and we were learning as we went along. But I think we have learned a lot from that. And your communication plan, you should look at lessons learned. I think we're past the point where we go back and talk about what people didn't do right. I think we have to look at what did we do or do wrong? What did we do right? And what did we learn from what we did wrong? And then start moving forward. And that's where it's really important when you're looking at your emergency preparedness plans and you're updating and reviewing them, taking a look at what were some of the federal, state, and local guidance that came along that will be helpful for you to include so that you're prepared for the next time. I think we learned about, making sure that the contact was in place, because it wasn't only something that affected residents, but these hazards, these disasters affect staff. We have to have that communication plan in place for how we're going to address these things with our staff, with the residents, physicians. Some people use volunteers to help in an emergency. There could be a lot of nursing homes I've worked with over the years. They've used volunteers in various capacities, and it's perfectly fine to use a trained volunteer if you have volunteers that come in and they're trained and you do things with them. They might live closer than staff does. So you should think about maybe including them in your disaster preparedness plan. And then again, what's your contact information? Who is your state and local, your county, your local county department that you really need to be in contact with? I know all of you know your state licensing and certification agency, your field office. But also the Pennsylvania Department of Health, your long-term care ombudsman, have them included in, what are the numbers, the names, how do you reach them? And then also looking at those primary and alternate means for communicating. You have to know how to communicate with all of them, and also your long-term care facility staff. And keep in mind, what happens during a hazard that could affect some of those ways that you communicate. You can scroll down a little bit, Kathy. So you can see that's all outlined here with the communication, and then that method for sharing the information and medical documentation for residents that are under your facility care. And then when you're looking at that, how do we share information if we need to evacuate? There could be situations where you do need to evacuate, or you may be able to shelter in place. So even if you're sheltering in place, how are you going to address that? How are you going to address the communication? How are you going to address the communication with physicians, with family? And then if you would have to, and also providing information about your occupancy, your ability to provide any assistance that's necessary. So having those things in place are part of your communication plans that you want to have. And then as you talk about, specific plans, that ties into your policies and procedures. And your policies and procedures are going to be based on those specific plans that you need for your nursing home. And again, the policies must be reviewed. So your emergency plan should be reviewed and updated annually. Make sure that you're also looking at your policies and procedures to see if anything needs changed. They also need to be reviewed and updated at least annually. And then you want to look at if we evacuate or if we shelter in place. If we shelter in place, do we have enough food, water, medical supplies for 5 to 7 days? What are our alternate sources of energy? How can we track staff and where they are? And how we're going to connect with staff. If we have to evacuate, how can we safely do that? Do we know who we call? Do you have a local transportation service that you have agreements with? So those are the things that, the outline shows you those things that you really need to think about, and then you develop those more intensely in your policies and procedures. I want to scroll down, then the last part of that moves into, and of course you can read some of this, like I said, those arrangements with other facilities, with other healthcare providers, transportation services, all those things that you need to keep in mind. And then the other piece of that is, again, a review and update and annual training. So you need to make sure that you've for training for the hazards that you've identified for your facility, your community, you provide that initial training in your policies and procedures to your new and existing staff. Any individuals, like I said, sometimes volunteers, consistent with their expected roles, you can include them. And then also those outside agencies that you have arrangements for services. How are you including them in your training and your planning? And then make sure that you have the documentation of the training that you're doing, so that you can provide that if needed. And then the testing, and we all, as I said earlier, that annual full scale exercise that is community based. So if you're doing, the one thing I want to point out, Appendix C does say in particular, if you're doing 1 year, you're doing an evacuation for like a fire, and you're testing, you're doing the drill, you're doing the fire, you're evacuating residents based on that. The following year, you should be doing something based on another identified hazard. So like they don't expect you every year. If you've identified several hazards, you should be doing some testing based on more than just the one area. The other thing, if and God forbid that this happened to anybody, but if you do have an actual disaster and you must go through that, you can actually use that as your annual full-scale exercise. I'd much rather go through an exercise than have to go through an actual disaster, but that's something to think about. And then you just really want to make sure that your emergency plan is just documented based on your risk assessment, the all hazards approach, that you're reviewing and updating all of those areas annually. I see we have a question. Let me see. Copy of this document. This document is the one, this is what we've developed, and we are actually finishing our final communications approval. And then we will be prepared to be sending this out, and Kathy's gonna talk about that a little bit later at the end of this. But yeah, we will be able to send this. This is something we've developed for all of you. So this is the outline. And Kathy, if you want to put up the checklist. So to go along, we call it our little toolkit, and it's very little because most toolkits don't just include two pieces of paper, but that's my toolkit. So then the checklist, it goes along with that. And the checklist I liked because we developed it, we talked about each of those sections, and I'm a checklist person. Not everybody is, but I am. And I like to be able to see, okay, this is the element that we want to assess. Do we have it or don't we? And then if we don't have it, this is what we want to work on. And so this is what we took the outline and we made it into a checklist. And as you can see, section 1, identifying that, and we also have a section in there where you can write who completed the checklist and the date. And so that's, you do this, you can review this annually too, to make sure that you have things in place. But identifying those hazards, again, we talk about, that community-based, your facility community-based risk assessment. You have that all hazards approach. You're thinking about everything that's included in Appendix C, those community partners that we talked about, all of those things that I really just reviewed in the outline. They're here for you to check. Yes, we have this in place. No, we don't. Or maybe you, and yes. And the one thing that we wanted to do is you can, when you have access to this, you can print it out if you like to print things out and have paper, and you can do paper, or you can also complete this electronically and save it to your computer. And then you can print it out, keep it in a binder. However, you decide that CMS was not explicit, and that's in Appendix C also. Believe me, when I close my eyes at night lately, all I see is the red letters of all the changes that were made, the red writing from Appendix C. They weren't specific on how you keep this, whether it's a hard copy, electronic, or whatever, but just if you do need to show your emergency plan and your specific plans in that you do know where it's at, you can get that documentation easily and show it to whoever might be asking. So we did this, so identify hazards, all those elements that should be part of that area. There's a yes, no, and then you can use that for noted areas for improvement. So you want to scroll down just a little bit more, Kathy. And then we moved into the communications, and that would be, looking at your plan and who that includes with your staff. And if you look down there, one of the things that we talked about when you're talking about your staff, you'll see different areas, like who's going to be your incident command person. You always want to make sure that you have somebody in charge and a backup. And it can be your facility administrator, but it doesn't have to be. It can be someone else. So you really want to take a look at, who is your staff, where are they located, how can they be reached, what are their roles? And again, this goes through all those things that we talked about with outside agencies and how they're going to assist you. And you can continue to scroll down. It talks about the medical documentation, if you're going to shelter in place, if you're going to send them out, just the different outline of roles and responsibilities, and really a lot of just the communication. And these are things that are part of your policies and procedures. You can go ahead and scroll down, Kathy. And then specific plans. And this is where, you have to think overall about those things: the food, the water, the medical, the pharmaceutical, do you have that outside generator in case you lose electricity? Those emerging infectious diseases. Honestly, I never say never anymore after COVID. Like right now, Africa's seeing a real increase in Ebola. Keep paying attention to what's going on out there, because we never know when everything's so international now. Be prepared for anything that might come along, and how you're going to address it. And really with those infectious diseases, it's those other questions. Now, we did get a lot of response from people, and it seems, and conversations that we have with many of you, we're still doing the QIO, still doing the outreach. If you've had increase in COVID cases, or you need to look at increasing your booster rates for your vaccines. So we're still doing that outreach along with the quality improvement work that we're doing. And we're hearing from most of you that, and we're seeing that you do have safe visitor policies in place, cohorting. You're more prepared now for where do we get PPE, what PPE might we need. So those things are more in place, but it's just, we've mentioned it in here under the specific plans, things that you need to keep track of. You can scroll on down, Kathy. And then the training and testing program really just added that at the very end, has, a yes, no. I think that's something that each nursing home really has to look specifically at how that's going to look for them. Oh, and I think Sonia asked the question about whether the document I was reviewing, if she was going to get that. And I told her that, yes, we will be giving out copies of this document. So I want to open this up really quick to see, does anybody have any questions for me? I know there was a lot to cover. Appendix C, there was a lot, that guidance to surveys, and you'll see we have resources here, and these resources, it takes you straight to the CMS fact sheet. It takes you to some resources that you need within the fact sheet. We have Appendix C as a resource. And anytime, like I said, under QSEP, there's the QSEP website. There's guidance to surveyors related to Appendix C. So just really make sure that you're aware and familiar of these different areas. So do we have anybody you can chat in? You can.
Yeah, so at this time, I think it'd be a good time to go ahead and start the discussion. So if you have any questions, you can send them to us using the chat or the Q&A tool to answer what Penny was talking about earlier and what everybody was asking. I will be sending these tools to everyone probably at the end of this week. I usually email everybody at the end of like a day or two after the webinar with the recording of this webinar. And I send it to the emails of everybody who registered. So everybody who's here today will receive an email from me with the recording of the webinar. And then I will include the links to both of these tools. And that will be a link to a PDF version of these tools. But if you like if you have Microsoft Word and you like the idea of being able to use those check mark buttons and be able to type directly into the document yourself, we can also email it to you as a Microsoft Word attachment. So just keep an eye on your inbox at the email that you registered for this webinar, and I will be sending that later this week. And I will also include the links in our newsletter that goes out on Friday called the Last Minute Lowdown. Let's see, looks like we might have another question. It says, I have a question. Do you want to ask your question out loud or do you want to type it in? If you want to ask it out loud, I can. Okay, just a moment and I will unmute you after I get my panel back up. I think I need to stop my share real quick.
Oh, it's Beth. Beth's gonna challenge me.
Uh-oh. Let's see. I need to stop my share though, because it collapsed my view and I can't see you.
You can stop the
you
share.
all.
They've seen the document. We're
Yeah.
gonna be sending it out. And it's one of the resources that will eventually, it'll be on our website and included in last minute
There
lowdown.
we go. All right, there you are, Beth. Beth, I allowed it to ask you to unmute if you want to ask your question.
Okay, first of all, Penny,
Hi, Beth.
what would life be without a question from me?
Oh, Beth, you keep me on my toes.
Okay, so back in the day, when we were doing our emergency plans, there was the I'm going to say expectation, probably not the right word, that the healthcare coalitions would be able to help support us during emergencies. And that when we had an emergency, we were to contact the healthcare coalitions and they were going to send, God and everybody to help us. COVID comes, that's not able to happen because everybody has this emergency. So the question is now, should we not even think that the healthcare coalitions will be available to help us through an emergency?
And my answer to that would be no, don't think that, because I think they also learned a lot. And I can tell you, the QIOs are national. And so we're aware of what happens in other states. I do have to say that, and the healthcare coalitions were part of this. As I said earlier, I mean, this was a learning experience for everybody. And I know nursing homes got the brunt of everything, which I think is totally unfair, but everybody had to step up and learn and pivot. We did develop long-term care RISE in Pennsylvania. It started out as the RCATs, the RICPs. They were learning where do we get supplies. The supplies that we thought might be available from federal and state weren't always there when they needed it. So what I encourage you to do, and as part of this, is look at your healthcare coalition, start the conversations with them now, include them in part of your emergency plans, and let them know that you will depend on them. What are some agreements that you might be able to come up with? So that's a great, and as usual, Beth, and I know I was joking around with you, but your questions are always good. And that is something. Do not disregard anybody. Open up the lines of conversation instead.
Okay, thanks.
Let's see. Yeah, I see there's Kathy, you're on mute.
You're right, I am on mute. We have another question. Do you want me to read it out loud?
Yeah, go ahead for those
who
might not.
It says, one of our surveyors is interpreting E0035, a method for sharing information from the EP with residents and their family or reps, to mean that we must send a letter annually. Another surveyor once told us that we could post a notice to our website. What are others doing to meet the definition of this guidance?
I would be interested in hearing what others are doing, and I think that, thank you, Martha, that actually brings up a good, something that we face all the time, I think, is that interpretation. I do believe that the guidance was not that specific, but what I need to do is take your question. I'll take your question and take a look at it and see if I can find that specific an answer to that, perhaps within Appendix C, and let you know. But okay, Leah, you said we're mailing annually due to a previous survey. So you are mailing annually. And I will look for, because here's the thing, we know that sometimes we do get different interpretation of how we're supposed to do things. So if I can find that specific answer within Appendix C, I will share that with you and the location of where you can find it. Other than that, the only guidance that we can give is whatever your surveyor is telling you, then I would suggest that that's what you do.
Penny, it's Beth. Can I suggest something on that?
Yes, please do.
I think that if you do a letter annually, that's fine for that moment in time. But now you've got other folks who are coming in throughout the year. I'm not so sure that we shouldn't take that letter and include it in the packet of information we give on admission, so that all admissions throughout the year get that information.
Oh, Beth, that's an excellent idea.
See, and it's not the questions, Penny.
Yeah, see, you have the great answers too. And I'm really glad you actually asked the question and spoke up, and I appreciate the feedback. When we are doing these webinars are something that because of COVID, because of the boosters and that, and addressing the guidance and these things that have developed over the last couple of years, we as a QIO, Quality Insights, told CMS we will hold these webinars weekly for our nursing home providers, so that we can try to put out there the most updated guidance and what's happening and keep them updated. But we also want your involvement. And I know I say this every time I speak, it's so important. You are the ones out there that we actually get some of our better ideas. We're getting straight from you, and we share those with other people. So we really, when I say we want your feedback, we want your participation, I'm really serious. And if you can speak up if you feel comfortable, or just in chat, like Sonia added your letters posted by your visitors sign in. And there's another great idea. You're the ones who share the really good ideas with each other. And we like to see that happening on these webinars. And we don't just want to be here talking for the sake of talking. And also, please feel free to email us and let us know if there are specific topics that you have an interest in hearing about. Because we're covering a whole range, just about everything can be related to COVID, boosters, infection control, and other measures that we all are looking at and working on. So please let us know if there are topics you're interested in.
You reminded me Penny, that I wanted to put put our contacts in the chat, so that's there. So my email, if you need to reach out to me, is ccaudill@qualityinsights.org, and Penny's is PIMES@qualityinsights.org. And that's in the chat if you would like to copy and paste that. And that's it for questions so far, but we don't have to wrap up just yet. I have a few closing items I'm going to go over, so you have another chance to either put your question in the chat or the Q&A, or you can use the hand raising tool if you would like to just ask it out loud, and we can give you access to unmute yourself. So while we're waiting, I'd again like to invite everyone to join us for next week's webinar, where we will be giving an overview of an upcoming course that we have on staffing solutions for nursing homes. So that will be next Wednesday at 2 p.m. again. And in addition to our webinars, we hold office hours twice a week. Those are live chat rooms where you can stop by, and someone on our team will be there to answer your questions or comments. So if you're interested in attending our office hours, those are on Tuesdays at 8 a.m. and Thursdays at 2 p.m. And you can find the links to the office hours and the webinars and more inside of our newsletter that we send out each Friday, called the Last Minute Lowdown. As I mentioned, I'll also put the links for those tools that we were sharing earlier in that newsletter, as well as emailing them to everybody here today. So if you would like to receive that newsletter but don't think you're on our mailing list, you can email me at ccaudill@qualityinsights.org, and I will get you on the list. So let's see if we have any more closing questions. I don't see anything in the Q&A, and I don't see anything in the chat. So do you think we're about ready to wrap up? Penny, do you have any closing items that you want to go over that popped into your head in the last minute?
No, really, just, the checklist will go out there. I'm again when you're joining these weekly webinars. We appreciate your participation. We'd like to hear about any additional topics that you'd like to hear about. And then we always, those resources that we put out, and again, that last minute lowdown weekly newsletter, there are always resources included in that. We appreciate feedback on the resources too. What resources worked well for you, how you use them. If you liked something a certain way that we did it, let us know. And that helps us know how to develop tools and education and things like that are helpful to all of you.
All
And
right.
thank you again. Thank you all for joining. We really, really appreciate it.
Yeah, we really, really appreciate you all taking the time to come and join us each Wednesday. And it looks like that's it for questions. So I think we can wrap it up. Again, I'd like to thank you all for joining us today. And Penny, thank you for joining us again today. And we hope that we can see you all again next week.
Bye.
Bye.